In this slide we will be discussing about this question, right? So this question is to find out the true statement about osteoarthritis. First statement is that knee is the most commonly affected joint in Indian population, right? Second one says hip osteoarthritis is more common than knee osteoarthritis in India. Third one says osteoarthritis causes movement restriction and instability of the joint. Fourth one says synovial thickening occur early, and fifth one says Hayward's node occur more commonly in female. So we will look at each of the statement, but before that we will discuss few points about osteoarthritis, right? So topic of discussion will be your osteoarthritis. So first point is here that osteoarthritis is your most common type of arthritis. Most common type of arthritis, right? This is your first statement, that osteoarthritis is your most common type of arthritis, right? Now it is also the most common age related degenerative joint disease, right? Most common age related degenerative joint disease, correct? Moving on. The prevalence of osteoarthritis increases with increasing age and increasing obesity, right? So these are also the risk factors, although we will discuss the risk factors separately. And there are two types of we can divide arthritis into two types. One is inflammatory, one is non-inflammatory. Inflammatory, of course, it is a rheumatoid arthritis, right? So there are two types of arthritis, inflammatory and non-inflammatory, right? And of course, talking about knee joint is most commonly involved, then hip, right? Now talking about, if I say the knees and hands are more commonly affected in women, right? And hips are more commonly affected in men. Now we will discuss it further after this initial introduction, right? See, if I talk about the joints that are involved, first I will say joints that are involved and joints that are spared, right, in case of osteoarthritis. So if I talk about joints that are involved, remember first carpometacarpal joint, very important, it is involved, right, in almost all cases, right? So first metacarpal joint, then first MCP, metacarpophalangeal joint, then it is your hip joint, of course, then knee joint, very important, right, knee joint, and then PIP, DIP, proximal interphalangeal joint, distal interphalangeal joint, right? So all these are affected in your osteoarthritis. Do remember, right? And most important is the first CMC and a knee joint, correct? And what all joints are spared? Joints that are spared are usually your wrist joint, your ankle joint, your elbow joint. These three joints are usually spared, right? They are spared. Okay, moving on. If I say about the symptoms, right? So talking about symptoms, there will be early morning stiffness, but in case of non-inflammatory type, it is less than 30 minutes. Now if it is more than 30 minutes, then of course it is inflammatory type, that is rheumatoid arthritis, right? So I hope this point is clear. Okay, so talking about risk factors, the things which I already mentioned is your increased age, increased obesity, of course these are risk factors. Along with this is your postmenopausal female is a risk factor, correct? Then few HLA associations are there, HLA A1, HLA B8, right? These are your HLA associations. These also comes under risk factors. Then your trauma is a important risk factor, right? So do remember these points, right? Also remember, if we talk about just an additional point, psoriatic arthritis and rheumatic arthritis, right? In this two cases. Do remember the DIP is frequently involved, right, in both psoriatic and rheumatoid arthritis. And talking about pathogenesis, though it is not required, I will talk in one or two lines. Just remember that the most important cytokine is your interleukin 1. So what it does, interleukin 1 will convert, or will just see, inactive inactive matrix metalloprotein. MMP is your matrix metalloprotein. So interleukin 1 will convert this inactive matrix metalloprotein to your active matrix metalloprotein, that will cause cartilage destruction, right? And this is your since you know that osteoarthritis is a degenerative joint disease, there is destruction, right? Destructions and erosions is there. So interleukin 1 is the main cytokine that converts inactive matrix metalloprotein to active matrix metalloprotein, that causes cartilage destruction. That is your osteoarthritis, right? Okay, so I'm writing here MMP is your matrix metalloprotein. Correct? Okay, so that results in degenerative joint disease, also known as osteoarthritis. So if I talk now, you will understand that actually what is osteoarthritis. So actually it is a type of degenerative joint disease, and it is characterized by cartilage degeneration, as I already mentioned in the pathogenesis, that results in structural and functional failure of synovial joints, right? So this is a degenerative joint disease. There is cartilage degeneration, erosions, and structural and functional failure of synovial joints. This is clear, right? Okay, now it can be divided into different stages, right? First is chondrocyte injury, right? They have divided into like this only. First is your chondrocyte injury. So this is related to genetic and biochemical factors. Then is your early osteoarthritis, and then is your late osteoarthritis. Okay, so in early osteoarthritis there occurs proliferation and secretion of inflammatory mediators, collagens, proteoglycans, protease, that acts together and remodels the cartilaginous matrix and initiate secondary inflammatory changes in synovium and subchondral bone. Talking about late osteoarthritis, actually late is a repetitive thing, right? Repetitive and chronic injury that leads to inflammation and chondrocyte dropout, leading to marked loss of cartilage and extensive subchondral bony changes. Okay, and joints involved, already I mentioned, hip joint, knee joint, right? PIP, DIP, and most important is a first CMC. Okay, so don't forget this point. And now if I talk about the radiological changes, first I will talk here about the changes, and then I will show in a X-ray. Okay, so in radiology, if we see in X-ray and all, what changes you will see, right? Let me write it here. First change is we will see joint space narrowing due to active degeneration erosions, right? We will see joint space narrowing, very important, don't forget, joint space becomes narrow. Then there is osteophyte formation at the joint margins. There is subchondral bone sclerosis, right? Subchondral bone sclerosis. There is subchondral bone cysts, I will try to show it. And there is bone remodeling. Okay, there is altered shape of the bone, right? So bone remodeling. So these things you will see in radiology. Joint space narrowing, very important, osteophyte formation, subchondral bone cyst, subchondral bone sclerosis, and bone remodeling. Now Talking about your treatment part, weight loss and exercise in the initial stages, these are advised. Okay, talking about in your pharmacological section, okay, here you can give supports as well, weight loss, exercise, and supports like crutches and different supportive device you can give here. Talking about pharma therapies, NSAIDs is the most important, and then is your DMRDS. Talking about DMRDS is your disease modifying antirheumatic drugs, and talking about them, I will like one drug for you to remember. This is your Diacetine. Diacetine is an interleukin 1 inhibitor, and now you know why we are blocking interleukin 1, so that the active matrix metalloproteins are not formed, right? So as to prevent cartilage destruction, right? Nice. And then I will like to remember you to remember another drug which comes under newer drugs. This is your tenezumab. So by AB you know that it is monoclonal antibody, right? Monoclonal antibody, and is your new growth factor blocker, okay, for NGF blocking, right? New growth factor blocking tenezumab. Tenezumab is a monoclonal antibody. By AB you know that is a monoclonal antibody. Okay, so we will revise the entire points and then we will go to the X-ray. Okay, so first we saw that osteoarthritis is the most common type of arthritis, and it is also the most common age-related degenerative joint disease. The prevalence increases with increased age, increased obesity, and there are actually two types: inflammatory and non-inflammatory. Inflammatory is usually your rheumatoid arthritis. Knee joint is more commonly affected in women than hip joint in men. Joints involved are your first metacarpal joint, first metacarpophalangeal joint, hip joint, knee joint, proximal interphalangeal, and distal interphalangeal joint. Okay, here I will like to mention a few important points. Said this is our hand. Okay, my diagrams are not that good. Anyway, okay, so if we talk about PIP and DIP, right? So do remember that here it will be your PIP, correct? This is a proximal interphalangeal joint that I marked with yellow. And if I talk about distal interphalangeal joint, I am marking it with orange color. Okay, distal will be here, no? It's a distal interphalangeal joint. Now see, if there is which color should I take? Let me take this one. Okay, so over a period of years, when there will be osteophyte development and soft tissue swelling, that will produce a knobby appearance, right, at the distal interphalangeal joints, right? So distal is this one, distal interphalangeal joints, which is known as your Haberden node, right? Haberden node, that it is as it is mentioned in your question as well. So Haberden's node is your pain and this one swelling, soft tissue swelling due to osteophyte formation at your distal interphalangeal joint. So distal is your Haberden node, and if it is proximal interphalangeal joint, if it is involved, it is your Bouchard's node, right? Bouchard, Bouchard node. Okay, so Bouchard node involves the proximal interphalangeal joint, and Haberden's node involves your distal interphalangeal joint. How will you remember? See, proximal means which is near, right? So remember the letter B is near in your alphabet orders, right? And letter H is your in far from your alphabet. If we take the alphabet order, letter H comes after letter B, so it is further, right? So distal means further and letter H means further in your alphabet line. So by this way you can remember Bouchard's and Haberden's node. Also remember that Haberden's node is 10 times more common than Haberden's node 10 times more common in women. Okay, so these two points you remember: Haberden's node more common in women and 10 times more common. Okay, so symptoms is your early morning stiffness. The joints that are spared are your wrist, ankle, elbow joints, right? So early morning stiffness less than 30 minutes is your non-inflammatory type, and inflammatory type more than 30 minutes. Risk factors: increase age, increase obesity, postmenopausal female, HLA-A1, HLA-B8, trauma, Also I told that remember DIP is involved in both psoriatic and rheumatoid arthritis. In pathophysiology I mentioned that interleukin 1 is the most important cytokine that converts inactive matrix metalloprotein to active MMP that results in cartilage destruction. So osteoarthritis is a degenerative joint disease, and if we talk about the stages, first is your chondrocyte injury due to genetic and biochemical factors. Then comes your early osteoarthritis, which is a secondary inflammatory process, and late osteoarthritis is a repetitive and chronic process, right? And radiological features include your joint space narrowing, osteophyte formation, subchondral bone sclerosis, subchondral bone cyst formation, bone remodeling. And treatment is your initially weight loss, exercise, supportive devices. Pharmacological treatment includes NSAIDs, DMRDs. I told you to remember Diacetine, which is interleukin 1 blocker. A new treatment includes tenezumab, which is a monoclonal antibody to block new growth factor. Now let us go to the radiology section. Let us see the X-ray, right? This one is what I was talking about, correct? So see, this is your normal knee joint, correct? See this space, well and good, right? Now see this space, this is the arthritic knee joint. Now you can see that this space is becoming narrowed because there is destruction and sclerosis all around, right? So this space is becoming narrowed, right? And we can also see osteophytes, okay, in some cases. And if we subchondral bone cysts are also seen. Now if we how it will look like. Now if we talk about subchondral bone cysts, it will look something like this. You can appreciate in some X-rays, right? And also there will be subchondral bone sclerosis, bone remodeling, there is alteration of the shape of the bone, right, in chronic cases, right? So all these are radiological features of osteoarthritis. So I hope this section will be clear for you, right? Okay, so now coming back to the question. So they asked that which one of them is true about osteoarthritis. So knee is the most commonly affected joint in Indian population. We saw that this is correct option, right? So this is true. Then they said that hip osteoarthritis is more common than knee osteoarthritis in India. This is not true. The reverse is true. Knee osteoarthritis is more common than hip. Okay. Then they mentioned that osteoarthritis causes movement restriction and instability of the joint. That is true, we saw, because there occurs bone remodeling, there occurs bone sclerosis, osteophyte formation and joint restriction, joint space narrowing, movement restriction, joint instability. Of course, these all are true. Synovial thickening occur early. Okay, this is also true. Synovial thickening occurs early. We saw that. And talking about the last option, Heberden's node occur more commonly in female. Also this is true, and it is 10 times more common in female. We saw that, right? So these A, C, D and E, these options are correct, right? B is false, right? Okay.